Thanks, Joshua. So today I will be presenting on two of our integration projects. As a trust, we have used eObs for a number of years now as our integration engine supplier, and we have undertaken many integration projects. I've listed some of our integration projects here, and these are the ones that are of our bigger and more complex integration projects. One of the most recent integration projects that we've gone live with is the bed management patient flow system called APFM, which integrates with our EPR system called Paris. The APFM solution takes the data from our Paris system and provides more of a graphical representation of our bed occupancy, bed availability that is displayed on our ward. So it's a very project that's been quite successful and very important to us. We have a number of projects that are planned for the future early next year. Two of those are DocMan and TPO. DocMan is the system that Fatih described earlier, which is automating the process of any GP letters from our EPS system that can be automatically sent via the integration engine to the system for GPs to download. Today, I will be focusing on two of our integration projects, the Cerner HIE My Care Record, Share Care Record as well as the Microsoft Power Apps e-observation projects. Now, these two projects actually drive the most traffic on our integration engine. So if we start with the Cerner HIE integration, we went live with Share Care Record back in 2022 with the aim of sharing the Trust Mental Health Care Service Users Record to other NHS organisations, including primary and secondary organisations, to have a singular overview of a service user, which in turn leads to better decision making and safer care. The Share Care Record is actually available through the local EPR system, and I do have a screenshot later on to show you how we access our Share Care Record. We share a number of data sets with Cerner, including referrals, booked appointments, inpatient admissions and diagnosis, all of which are crucial to making better decisions for service users. In the new year, we are also planning to add to that data sets to include documents such as GP letters, care plans, as well as medication information from EPMA. The technical setup required a data repository, and the Trust purchased eObs data repository. Now, the setup of the data repository is probably the most complex part of the entire project that we experienced. We did an initial upload of data that's required for the Cerner data sets into the data repository, and that data came from the data warehouse, which is fed by our EPR system on a daily basis. So once we uploaded the data in the data repository, we stored that data in file format, making the messaging later on a lot quicker and a lot easier. Once the data repository was set up with the initial upload, we used the integration engine to check for any new or changed data from our data warehouse on a daily basis to keep that data repository up to date. Again, once the infrastructure was all there, Cerner provided us with some connection details, and because they're on the Health and Social Care Network connection, it's slightly easier to connect. They also provided us with an authorization token, as well as setting up some security certificates. So I've got a diagram here, probably simplifying how the whole process works, but we receive a message from Cerner about a service user with an NHS number and a date of birth. That hits an endpoint on our integration engine. The integration checks with the data repositories to see if there is a match with the data that they provided. And if there is, we send that message back in file format as requested by Cerner back to Cerner. Obviously, if there isn't a match, we send the appropriate message. So as I mentioned earlier, this is a screenshot of our EPR system. It's a test user here, so we've not got a vast amount of data here. But there is a tile for My Care Record that's been installed, and that's how we access Share Care Record. The top part of the screenshot shows you exactly which organisation have submitted data. And it's not clear, I can see that, but there are tabs here to show the clinical information for our service user. So if we had an appointment coming up for the service user, it'll be displayed under this tab here. So I've pulled some stats here for this financial year, and as you can see, we get over 300,000 Cerner requests per month, and I think that provides a numerical format of the success of the project. So that is a lot of traffic that hits our integration. It's a lot of requests for service user that can only ultimately mean better care for safer users. I've got this little diagram chart here, from the Hertfordshire and West Essex Share Care Record website, and as we can see, I think that says October there. For October, we have over 100,000 users that are actually from Hertfordshire and West Essex. There are other organisations that do use Share Care Record, including Milton Keynes, London, Luton's. Those are the ones that I can remember so far. But without the integration, you know, I don't know how we could handle 300,000 requests or data for service users. So this has provided a lot of integration benefits for us, which leads me next on to this slide, really. So there have been a number of benefits from this integration. So clinicians now have immediate access to a service user's data, so they no longer need to make a request. It reduces all that admin process that existed previously. We now have mental health information available alongside physical health issues, and that provides an overview of a service user. Now, that can only mean better decision-making, better care, which is the ultimate goal of sharing data. I mentioned before, staff time has been saved because we no longer got an admin process there. And one of the other operational benefits is that it reduces any duplication of work. You can easily log on to Share Care Record and to see if you were going to make a referral for a service user, you can quickly check on Share Care Record to see if that referral has also been processed by somebody else. So we do have a lot of benefits from this project. Moving on to the Enhanced Observation Integration projects. Before I continue with this part of the presentation, I'd just like to make clear that the Microsoft Power Platform, the licensing, the NHS tenancies is out of the scope of this presentation. It'll focus more on the integration we have with one of our apps, which is the which is the eObs app. But if there are any questions with regards to the Microsoft platform and how we've got all that set up, please do contact me after the presentation. So with regards to eObs, the Trust had a very paper-based process in capturing our observation for service users. It wasn't a safe process. You know, paper records were misplaced, they were lost, and it all led to clinical incidents. So there's a need to automate that process, and an app was developed to capture that paper process on the app itself. The app is delivered on the Microsoft Power Apps, and it was delivered on Samsung Galaxy tablets that were purchased for the Trust. So there is mobility with this integration and app. The data from the app has a live feed to the Paris system. It reads data from Paris about service user, and it also sends and writes data back to Paris, including the observations. Similar to Cerner, we went live with the eObservation app back in early 2022. We started off with an initial rollout to one ward, but due to the success of that ward and the success of the integration, we rapidly rolled that out across all our inpatient units. In terms of the technical overview, the setup is very much similar to all integration projects and similar to Cerner as well. So the Power App connects to the integration engine via a URL, a username, and an authentication token. The app itself makes 3 calls to the integration engine, which pulls data back from Paris, as I mentioned earlier. One of the API messages it calls is retrieving ward information, so what ward the staff is interested in. The inpatient API data, which calls back service users data for those that are on that ward. And the final one is the observation checks, which pulls back any observation that the service user is currently on and any historic observation. So staff do have the ability to record observation on the app at real time with the service user, and that recording is then transferred from the Power Apps to the integration in a JSON message, and then the integration only writes that back to our EPR system using Paris APIs. This is a screenshot of our eObservation app. Again, it's a test user, so barely got much information there. But as I mentioned, one of the calls that makes is the ward that you would like to record the data for. So if you select your ward there, that's your first API call. Your second API call retrieves back the service user's detail on that inpatient unit. When you select a service user that you're interested in, it takes you to this following screen. And in this screen, it shows you the third API call, which is the observations recording and historical observation for that service users. At this point, you can end an observation and record new observation. So that's a brief overview of how the app works. Again, I've got some stats here for this financial year, and I did mention earlier that these 2 projects generate the most traffic on our integration engine. So for the eObs app, there are over over 100,000 messages that hit our integration engine. That does include reading information and writing back to the Paris system. So benefits, I mean, this project digitalized an entire paper process, and that in itself brings back so much benefits. There's less paperwork, there's more use of modern technology. People don't have to use paper anymore, then go onto the system, upload it, scan it. It avoids all of those processes, which in turn saves time. It's providing much more safer care. You know, paper records are no longer lost. They're not misplaced. They're not hidden in cupboards like they used to be. With capturing the data electronically and having it on our EPR system as well, we're able to report on that data at any level, the service user level, ward level, at trust level overall. So the app and the integration does provide a complete service user record, accessible in real time by staff, and all of these benefits have provided safer care to our service users. I think that's it from me, Joshua.